Hello, I'm Keith Fickenscher, Co-Chair of NHCA, and I want to speak to you straight from my heart today. This message is born from the experiences I have had since my stroke last June. In the 10 months separating me from that profoundly life-changing event, I have been a patient 4 times in 2 hospitals for a total stay of 1 month, and I've spent 4 months in 2 rehab facilities. I have a new appreciation for the good health I was blessed with for 6 decades, and a fresh perspective on what it means to surrender your independence, your mobility, your control over your life, your familiar surrounding, your hopes, your plans, and even your optimism, to become an inpatient stroke survivor. You realize that the speed and extent of your recovery, as well as the quality of your life, are largely dependent upon the skill, dedication, and passion of the staff serving you, and I mean all staff. I'm going to present a program at our fall convention which will speak directly to this point. But today I want to tell you about another revelation I had as I contemplated what will be required of us to maintain the renowned quality of life that Nebraska's skilled nursing facilities and assisted living facilities now offer. The answer lies in a strong association that fairly represents us and effectively advocates for the best interests of our industry. Our responsibility as members is to get involved, to support and defend our association, to contribute in creative ways to our political action committee, and to elect thoughtful and visionary leaders who will guard against the undue influence of special interests in the important work of protecting all the members. The most important duty of our association, considering the political landscape of sequestration, gridlock, and budget deficits, is to support members' efforts to operate in the black. A margin of profit is the only way to pay for raises, benefits, staff education, equipment, and buildings. None of us can possibly monitor all legislation and successfully advocate all of the issues for ourselves on the state and national levels. That is why we must have strong state and national associations. If we didn't have NHCA, today we'd be talking about how we could go about creating it. The past 3 years have been a time of significant change and repositioning, with a focus on transparency, quality, and inclusiveness in the manner in which NHCA represents the entire membership. The result has been new leadership, new programs, and even a new office building which the members now own for virtually the same money we spent on rent. Now it is time to reflect on what all this means to the membership. How do we make sure that going forward the changes of the past 3 years will mean a better product and a better service for you? In my mind, the answer is this: as long as your association commits to doing the right thing for the right reasons for all our members and ensures we have the best people on board to carry out our mission of support, advocacy, and education, we will indefinitely continue our 66-year legacy of growth and strength. And that brings me to a very important lesson I learned in my 18 years working for farmers in their farm cooperatives. If a farmers co-op or a healthcare trade association does a good job of regularly explaining to the members what it is doing for them and why, the members will support the necessity of banding together under the umbrella of a strong trade association. As I reflect on the past few years where Helen and I have worked diligently to erase the line between the nursing home and assisted living sides of your association, I want to shout out that we have been successful, and the result has been a major turning point in our association's collaborative culture. I consider that achievement to be the most significant legacy of our time together of serving you. Your association has had a remarkable year. The education offerings have been of higher quality, have been more relevant, and have attracted more participation than ever before. Through our PAC, we contributed more to political campaigns than ever before, and our legislative advocacy has been intense and effective, practically assuring the membership we will see a 2.25% increase in Medicaid rates in each of the next 2 years. NHCA finished 2012 financially sound, And we ended up in a new office space which will accommodate the members for decades, one which met all of our selection criteria and was financed on monthly payments equal to what we used to pay in rent with no dues increase. That alone is an extraordinary accomplishment. More important than all that, in my opinion, is the fact that a large piece of the healthcare continuum in Nebraska, our piece, including long-term care facilities, skilled nursing facilities, assisted living facilities, hospice and palliative care agencies, and related caregiver groups, were very capably represented, defended, and educated by a strong, capably staffed, and well-managed association dedicated to serving their best interests and doing for them what they could not possibly do individually. Through a strong NHCA, these groups have gained some vital influence over their destiny, and that is the most fundamental reason for the existence of any trade association. I hope the members of our association appreciate and support the efforts NHCA makes every day on their behalf. The members have done a good job in selecting their leaders. The directors have set a course for NHCA that is focused on being relevant, inclusive, respected, transparent, and effective. Now, the greatest asset of any organization is the people who perform the daily tasks. NHCA has an employee group second to none. They are dedicated, responsive, and committed to serving you, the members. There can be no denial of the fact that NHCA is a dynamic force working for the best interests of those it represents. This force will grow or shrink in direct proportion to the loyalty and commitment of the members of this association. Let's build on what has been passed on to us and thereby ensure it will always be possible for our vital industry to survive and thrive in Nebraska. Consider this: if our membership cannot survive in Nebraska, the fallback plan would have to be for the state to care for the frail elderly. In the last speech of his life, given on November 1st, 1977, Senator Hubert Humphrey said, "The moral test of government is how it treats those who are in the dawn of life, the children, those who are in the twilight of life, the aged, and those who are in the shadows of life, the sick, the needy, the dying, and the handicapped." I'm not convinced our government is meeting that moral test as well as it could, but I can tell you I believe the people in this association are. You are taking to heart Jesus' admonition in Matthew 25 to care for the least of our brothers and sisters, the elderly, the sick, the needy, the dying, and the handicapped. In this industry, we are not called to serve only those who are like us, or just those who appeal to our senses of sight, smell, and hearing. We are called to serve all people. You do that, and your association is proud of you and exists solely to support and defend you in every possible way. I'm standing today for these remarks as a symbolic gesture of appreciation to NHCA, which today in our state is standing tall, looking good, and proudly representing your building and mine in caring for the least of our brothers and sisters. From my heart, thank you, and God bless you.